In the United States, Congress isn't the only place where pressure is mounting to see Obama's healthcare plans go through. As D-Day draws near, many people have taken to the streets, many of them in Washington. They want Obama's promise for change to materialize into something that will improve their lives.
Even though we have health insurance, we're basically going broke because we're trying to keep our kid alive and we have to pay a 40% copay. I'm also here because she's got a pre-existing condition. At 3 years old, she's got a pre-existing condition, which means that if we ever lose this health insurance, we're out of luck.
The present economic situation isn't helping Obama's proposed healthcare reforms. Tara and her boss, Madeline, are both well aware of this. With thousands of small businesses closing down every day, insurance is an unaffordable luxury. This gift company is still in business, but for its workers, their salaries are barely enough to get them through the month. Medical insurance and pension plans are out of the question here, and bosses are under no legal obligation to provide cover. The choice is simple: work without insurance or have no work and no insurance.
I'm lucky to have a job here, and it at least allows me to look for something else, another job that might have insurance. But it's much better to work without insurance than to not have a job and not have insurance.
Sadly, the choice is either you take a job without any insurance, or else, well, you won't be able to find a job. It makes me sad, but, well, that's just the way it is.
So it's choosing between working without insurance and unemployment.
That's it, to eat or not to eat.
35 people used to work for this firm, but now only 4 are left. Adrienne had to give up her job there for medical reasons. It's now been 12 years since she had health insurance. She lives in fear of getting hurt and not being able to pay the hospital bill. She can't even have basic dental care, leaving her feeling like a second-class citizen.
They need about $8,000 worth of work. And when you can't pay for that and your income basically gets you through each month as far as your bills, it's difficult, very difficult.
If Obama's healthcare law is passed, it could change the lives of those Americans who need it. Adrienne is keeping her hopes up, but knows the battle isn't won yet.